Okay, this is my Jim Cramer, they know nothing moment. I'm sure there are more of you out there than just me who share the opinion that this COVID-19 response has gotten a little out of control. I mean, if you watch typical media station or listen to a lot of the leadership out there, you would come away from it taking that if you get COVID, it's like a death sentence. You should kiss your ass goodbye because it's over. You need to avoid getting COVID at all cost. Okay, I would like to take a little more well-reasoned data points at this. I have some statistics I'd like to just give you real quick. I'm not going to give you a whole laundry list of them because I'm not going to waste your time with that. I'll just give a few quick ones here. The first one is 80% of people who get COVID have mild to no symptoms. The second really major important one is that the first COVID patient that was treated in the United States was treated by a Dr. Diaz, who is in the Seattle area. And he happens to be the section chief of infectious disease for Providence Health. He stated that 95% of their deaths were in people over 60 years old. 95%. So the whole idea that we're going to shut down and have everybody, regardless of age and health condition, stay at home is ludicrous. Okay, a better solution would be you have a stay-at-home order for anyone that's 60 years old and over, because we know that's high risk, and anyone that has a compromised health system, whether that's a heart problem, lung problem, diabetes, cancer treatment, whatever. If any of those groups, you have a stay-at-home order. There's also a do not contact order to the greatest extent possible for people who are not in those groups or they're under 60 and healthy to not contact those people because we're trying to keep them from getting the disease, obviously. We're trying to help them, keep them from being, hospitalized in the worst case situations and being on ventilators. That's to alleviate the problem on the health system. So that's what we would do, number one. Number two, since businesses are now going to be open and allowing commerce to go on and allow our revenue streams to keep coming into not only the states but the federal government, so that we can pay for a lot of these things that we've now committed ourselves to, and we have to pay for them somehow. The businesses that were staying open would be required to have a wash station / sanitation station at their entrances. Both employees and customers would be required to utilize that going into and out of the business. They would also be required to, at the beginning and end of the business day, the businesses would have to wash down and sanitize basically all of their entrance door handles and knobs, the areas at the check stands where are frequently touched areas. All those places would be sanitized at the beginning of the day and once an hour throughout the day. Lastly, you would only allow one customer per 100 square foot of customer space in each business. And customer space just means basically you take the floor print of the business, you subtract out all of the storage areas, warehouse areas, employee only sections, behind the counter, that sort of thing, and you just get to the actual floor space where people can actually walk around. One person per 100 square foot of that is equivalent to about one person in a small to medium-sized bedroom. That keeps your social spacing. The end result of all of this would be that we accomplish the same goal of limiting the spread, especially to those most vulnerable that would end up occupying the hospitals, and that alleviates the stress on the hospital system of bed space and, again, resources. It would alleviate that, but it would keep the economy going so that we could maybe avoid any more of these bailout bills that we're basically doing, which we can't even afford. We just passed in Congress a $6 trillion total bill package to basically help get us through this time that we've sort of self-inflicted. The problem is this whole stay-at-home order for everyone, regardless of health condition or age, is pretty much like the whole adage of the medicine is worse than the disease. And by doing this, we're creating an economic mess that we don't have to if we would just be a little more prudent in our solution. So it's just an idea that I think makes much more sense. Maybe some of you do as well. If you agree, then please spread these ideas or this video or whatever. I just like to get the conversation going a little more. I'm not trying to say I'm the only person with the best answer, but I think these types of solutions should be considered in the process. It shouldn't be an all or nothing. Nothing or everybody stays at home. Let's get through this together. We've gotten through much tougher things as a country. We will get through it. Take it seriously, but not too seriously. Thanks for watching.